everyone, my name is Martha Law and welcome to my video post. Today I'll be discussing key concepts from the personality disorder diagnostic features and the videos we watched this week. Specifically, I'll cover the similarities and differences among the personality disorder clusters, reflect on why certain clusters share overlapping traits, and explain whether co-occurring personality disorders can occur within the same cluster. Cluster A is often called the odd or eccentric group. It includes paranoid, schizoid, and schizotypal personality disorders. They all share traits like social withdrawal and mistrust, but they show up in different ways. Paranoid PD involves constant suspicion of others. Schizoid PD is marked by an emotional distance and a preference for being alone. And schizotypal PD adds unusual beliefs or eccentric behavior to the mix. Cluster B is known as the dramatic or emotional group, which includes antisocial, borderline, histrionic, and narcissistic personality disorders. They all tend to involve strong emotions, impulsive behavior, and rocky relationships. But each one looks a little different. Antisocial PD shows up as a lack of empathy or concern for others. Borderline PD involves intense emotions and fear of being abandoned. Histrionic PD is more about attention seeking and dramatic expression. And narcissistic PD focuses on grandiosity and the need for admiration. Cluster C is the anxious or fearful group, which includes avoidant, dependent, and obsessive compulsive personality disorders. They all come from anxiety and insecurity, but the focus is a little different for each. Avoidant PD centers on fear of rejection, dependent PD on needing others for support, and OCPD on perfectionism and control. The videos highlighted some important insights, especially regarding Cluster B. Why are there significant similarities among Cluster B disorders? Many Cluster B disorders share roots in early attachment disruptions, trauma, or inconsistent caregiving. Because of this, individuals often struggle with identity development, emotional regulation, and maintaining healthy relationships. These shared developmental foundations help explain the noticeable overlap in symptoms across the cluster. Why is it important to understand the differences between Cluster C disorders? Even though all Cluster C disorders involve anxiety, the source of the anxiety and how individuals cope with it are different. Understanding these differences is crucial because it directly influences treatment. For example, avoidant PD may require building confidence in social exposure. Dependent PD focuses more on boundaries and developing autonomy. OCPD treatment emphasizes cognitive flexibility rather than anxiety reduction alone. Recognizing these distinctions helps avoid misdiagnosis and ensures the most appropriate and effective treatment plan. From a psychological viewpoint, yes, co-occurring personality disorders within the same cluster can happen. Since disorders within a cluster share core traits, it's not uncommon for someone to meet criteria for more than one. Some examples include in Cluster A, paranoid and schizotypal often overlap due to mistrust, social withdrawal, and distorted thinking. In Cluster B, borderline may co-occur with histrionic or narcissistic because of emotional intensity, need for validation, and unstable relationships. In Cluster C, avoidant and dependent frequency co-occur since both involve fear, insecurity, and reliance on others for reassurance. These combinations make sense because the disorders share similar underlying emotional or cognitive patterns and making it more likely that traits overlap. Understanding both the shared features and distinct differences of each personality disorder cluster supports accurate diagnosis, compassionate treatment, and better client outcomes. Recognizing overlap also prevents labeling someone too narrowly and instead allows us to view the person more holistically. The references for this video were American Psychiatric Association 2022 Diagnostic and Statistical Manual of Mental Disorders, 5th edition, the Theravive Counseling Personality Disorders Overview video YouTube, Clinical Psychology Personality Disorder Clusters A, B, C Explained YouTube. Thank you for listening to my reflections, and I look forward to hearing your reflections as well.